Healthier Lancashire and South Cumbria is basically just a place, but within that place are lots of organisations who provide health and social care.
These kind of epic events are just brilliant. The enthusiasm in the room this morning was palpable. You could really sense people's appetite for working together because they knew that this is the way that they're going to get results.
More than 100 people presenting, looking at really, really good examples of local work from healthcare, local government, social services and voluntary and community faith sector about how those connections and that work is making a difference for individuals.
Partnership working is key because we need to provide consistency to patients.
It's an opportunity to bring together all the different elements that can make up improving health and wellbeing for our populations. And it's about recognising a lot of the things that are impacting on people.
It's so important not to just be in a silo because you can't work on your own. You've got to work in this collaboration for the good of the patients and the rest of the staff.
We've heard from some fantastic speakers around the work that they're doing in their trusts, some great opportunities that we need to be sharing far and wide, both workforce related and just in terms of clinical developments and clinical services. We've had a great insight into some new technologies that could really help our patients.
You can't have a culture of trust unless you bring people together and talk and listen, so I think it's vital that we do days like today.
The ICS is doing the right thing. It's feeling its way, it's finding its way. How do we do this right? And they're doing it from a bottom-up approach, which is absolutely key.
The wealth of passion that was in the event from the different professionals that presented here, projects that I'd heard about, but actually listening to the people delivering those projects and what it means to them and why they've driven that project forward has been massive. And also ideas from other areas that we can actually now take forward with a little bit of tweaking that will pay dividends for our families, and that's really why I came, so I'm quite pleased with that.
I've made lots of new contacts. I've had an ambition within the Innovation Agency to take a bus round our footprint, and today I found a bus.
We need to work very closely with our partners in the NHS, and we need to also raise our profile within the NHS as well. So to come here and make contact with so many people is a great opportunity to be here.
Yeah, I think it's an opportunity to come away from the day-to-day, share what you're doing, get some recognition of that, and I think the number of people that we had asking, how do I contact you, how do I get in touch with you, how do I learn more about what you've been doing, is the best part of the day.
What I've learned from today is there's lots of change going on, there's a huge appetite for change and lots of people want that to happen, so let's do it.